Okay, so we all know hospital accreditation is, well, pretty fundamental for healthcare quality.
Globally, absolutely. It's the benchmark, supposedly, for safety, for standards.
Right, but here's where it gets interesting. Despite how crucial it is, the actual sustainability of these accreditation models, it's kind of under threat.
It really is. I mean, think about how fast healthcare is changing.
Yeah.
You've got digitalization, telehealth, all these new challenges popping up constantly.
Yeah.
And often the accreditation standards they struggle to keep up. They can feel a bit static, you know?
Mm-hmm. Static in a dynamic world. So this deep dive, we're really aiming to unpack what improvements are genuinely needed to make these systems sustainable for the long run.
Exactly. What needs to change?
And for that, we're looking at a really interesting 2025 cross-sectional study. So it's like a snapshot, right? Capturing opinions at one point in time.
Uh-huh.
And it zeroes in on the views of hospital quality managers in Saudi Arabia. These are the people, boots on the ground, making sure standards are met and improved.
The ones actually doing the work. Their perspective is key.
Totally. And what they think offers a pretty clear roadmap for keeping hospitals accountable and, importantly, continuously getting better.
And the study, it's surveyed 158 of these quality managers. So a decent sample size.
Yeah.
And these aren't rookies. They had nearly 7 years of experience in quality management on average. So their collective insight, it's invaluable for understanding the real challenges.
Right, the practical side of it. So the study basically grouped their ideas into 4 main buckets.
Mm-hmm.
You had accreditation policies, then how the standards themselves are developed, the evaluation methods used, and finally the evaluation team, the surveyors.
Okay, those 4 areas.
Yeah. And interestingly, improving how standards are developed, that came out consistently as the most critical thing.
Really? More than the others?
Yeah, closely followed by policies and the evaluation team. The actual methods, while still important, were seen as maybe slightly less urgent overall.
That is interesting. So within standards development, what was the big recommendation?
The standout was shifting the whole focus. I mean, really shifting it.
How so?
Instead of just, checking compliance, checking structures are in place.
The usual ticking boxes.
Exactly. The emphasis needs to be on actual outcomes, patient outcomes, and continuous improvement.
Okay. So moving beyond just process to actual results.
Precisely. It's not just a minor tweak. It's like rethinking what accreditation is even measuring. Is it making patients healthier?
That's a fundamental change. From oversight to actively driving improvement. What else about standards?
They also really valued updating standards more regularly, making sure they reflect the latest best practices, the newest research.
Which makes sense. Healthcare doesn't stand still, so accreditation shouldn't either.
Definitely not. Okay, so let's pivot to accreditation policies. What was top of mind there for these managers?
The big one there was integrating the consumer or the patient perspective into, well, everything.
Everything.
Yeah, right down to the actual decision-making process for accreditation. It was seen as paramount.
Wow.
Yeah.
So really putting the patient voice front and center.
Absolutely. It underlines that whole shift towards truly patient-centered care. Their voice is critical in defining what quality actually means.
Got it. Okay, standards, policies.
Yeah.
What about the evaluation methods? How they actually check things?
Right. This is where technology really enters the picture. The managers emphasize pretty strongly the importance of bringing in things like emerging telehealth and artificial intelligence into how evaluations are done.
AI in accreditation. Interesting.
Yeah. And they also stress moving away from the traditional sort of snapshot evaluation, that one-off audit every few years.
Right, the big inspection day.
Exactly. Towards what they call continuous clinical performance triggers.
Okay, unpack that a bit.
Think of it less like an annual exam and more like constant real-time monitoring of key performance indicators, key health indicators.
So it's an ongoing assessment.
Yeah, an ongoing check on compliance and quality, much more dynamic.
That sounds like a huge shift. Transformative, really. Okay, finally, the evaluation team. The surveyors themselves. What did the quality managers want to see change there?
A really key thing was implementing strategies to minimize the variations between different survey teams.
Consistency.
Exactly. Quality managers clearly want everyone assessed fairly reliably, using the same yardstick, basically.
Makes sense.
And they also flagged the importance of recruiting surveyors based on robust, clear selection criteria, getting the right people for the job.
And did experience play a role in how managers felt?
It did, actually. Yeah. The study noted that managers with more experience tended to rate these suggested improvements as even more critical.
So the longer you're in the system.
The more you see its limitations, probably. Yeah, they've likely seen the impact of inconsistency or outdated standards firsthand over the years.
Right. Okay, so let's tie this all together. What's the big takeaway here?
Well, I mean, these insights from very experienced managers, they really offer a powerful roadmap, don't they, for redesigning hospital accreditation?
Yeah, it feels like it. It's definitely about moving beyond just checking boxes.
For sure. It's creating a living, evolving system, one that really champions real-world outcomes, embraces new tech like AI.
And, crucially, puts the patient's voice right at the center.
Exactly. And if we step back and look at the bigger picture, this really underscores a fundamental shift, maybe a paradigm shift.
From static compliance
to dynamic, continuous improvement. Which, I think, leaves us with a really important question for you, the listener, to consider. As healthcare keeps transforming, at this incredible pace, how quickly can the accreditation bodies around the world actually adapt? How fast can they integrate these kinds of changes?
To make sure that quality improvement isn't just a goal,
but a constantly reinforced reality.
Yeah.
For every single patient.